Hello, good morning, ladies and gentlemen. Welcome to you all. Great to see you this morning. I hope you're well rested. I'm Shuli Ghosh. I'll be leading us through today's discussion on the lessons learned from the global pandemic response and new perspectives on pandemic preparedness. I think if there's one thing we can all agree on about the COVID-19 pandemic, it is that over the past 18 months, we've seen unprecedented cooperation between governments, international organizations, healthcare professionals, the biopharmaceutical industry, and others. And it's resulted, among other things, in the fastest vaccine development to date. But despite the extraordinary efforts to tackle the COVID-19 pandemic, the response in many ways has been hindered because the world simply wasn't prepared for a crisis of this magnitude. There was a lack of pre-established coordinated policies and processes, and really a lack of global understanding on how to address key challenges. So today we're going to focus on the successes and failures and identify the key lessons that can be drawn from the response to the pandemic to date. What do we still need to work out? And what are the indispensable elements that we need to put towards the next pandemic, which will form and support a coherent and effective response? My speakers today, they're a fantastic panel. They've been at the forefront of dealing with the pandemic from all aspects of the crisis. So let me introduce them to you now. And as ever, we have some joining us online. Some of our audience are joining us online as well, and some are here with me on stage. So joining us online, we have Dr. Ngozi Okonjo-Iweala, Director General of the World Trade Organization, a global finance expert, an economist, and international development professional with over 30 years of experience in Asia, Africa, Europe, Latin America, and North America. We're also pleased to have Professor Jose Manuel Barroso, chair of the Gavi board. And before coming to the Vaccine Alliance, Professor Jose previously served as Prime Minister of Portugal and as President of the European Commission. Gavi, of course, one of the co-leaders of the global COVAX vaccination initiative. We have Professor Kelly Tshibale also joining us online, founder and director of H3D, Africa's first integrated drug discovery and development research center based at the University of Cape Town. He's also chair and CEO of H3D Foundation, a professor of organic chemistry, and was recognized as one of Fortune magazine's top 50 world's greatest leaders in 2018. Here with me in the studio, directly to my right, is Professor Dr. Veronica von Messling, Director General Life Sciences, Federal Ministry of Education and Research in Germany, also a board member of the Global Antibiotics Research Partnership in Geneva, and previously Director of the Veterinary Division at the Paul Ehrlich Institute. Her expertise lies in the development of novel prophylactic and therapeutic strategies against infectious diseases. Thomas Cooney, Director General of the IFPMA and Secretary of the Global Biopharmaceutical CEO Roundtable. Thomas also represents the innovative biopharmaceutical industry on the ACT Accelerator, the global collaboration to accelerate the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. And finally, we have Andrew Jack, Global Education Editor for the Financial Times, previously head of curated content, deputy editor of the Big Read section, pharmaceuticals correspondent, and a foreign correspondent in France and Russia. And Andrew has written extensively on the global response to COVID. So welcome to all my guests. And also there will be an opportunity for you, the audience, to ask questions. So whether you're joining us online or whether you're here in person, please get ready with your questions. The panelists are very ready and eager to answer your queries. For the people here in the audience, there will be microphones circulating. So if you have a question, you can simply put your hand up, and I assure you, as ever, the microphones are all going to be cleaned in between questions. So let's get started, and we are going to start with a quick fire round. I'm going to ask each of my panelists to limit their answers to 2 minutes, please. And we're going to start with the basics. I just want each speaker to tell me what has worked and what hasn't during the pandemic response so far. So let's start with Dr. Ngozi Okonjo-Iweala. What went right? What was a failure, Dr. Ngozi?
Well, thank you so much, and good day to all my fellow co-panelists. I think what went right, you've already mentioned it, the incredible partnership between the public, private sector, the pharmaceutical industry, research and development, the incredible innovation that led to these vaccines in record time. I think that has not been seen ever before in the world, the kind of speed. So that really went right. I think what went wrong is having now discovered this technology which can save lives. We've not been able to get the technology to places where it's needed. And it is the inequity of access to vaccines, the fact that 80% of vaccine exports come from 10 countries, the heavy concentration has led or contributed dramatically to this inequity of access. So how can it be that we can have the technology to save lives? And we find that in the rich countries, more than 60 to 70% of the population is vaccinated. In low-income countries, 2%, 1%, 4% on the African continent, such low numbers. That's gone really wrong.
Dr. Ngozi, thank you. Professor Jose, what went right for you and what went wrong?
Thank you first of all, for inviting me for this very important meeting with such distinguished colleagues in the panel. First of all, what went wrong was that the world was not prepared. Including the most powerful, the most developed economies in the world were not prepared. And I think it's very important to understand this, so to avoid this happening again, to avoid improvisation, to avoid everything that we could have avoided if the leaders of the world had been prepared. What went better was, in fact, science. Science worked better than politics. Extremely quick development of new vaccines, unprecedented speed, and also successful cases of cooperation. An example, COVAX, that was in fact initiated by Gavi, the organization I have the honor now to chair, succeeding Dr. Ngozi, together with the World Health Organization, together with CEPI and UNICEF. We have shown it is possible to reach all the world, but what went wrong there also was that we had not enough vaccines. There was a problem of supply, to a large extent because of vaccine nationalism. So not good behavior from some governments. So in all fields, there were issues that were positive, and we can build on them, mainly cooperation, including collaboration between the public and the private sector, but there were also things that went wrong, and we should take full lessons from that experience.
Thank you very much indeed. Professor Kelly Chibale, what are your thoughts?
Thank you very much, and thank you for the invitation to be part of this panel. I think this is going to be like we're singing from the same hymn. I think that the one real thing that really worked, I think, has been highlighted already by Jose, Dr. Ngozi, is really the importance of research and development. And I don't really want to rehash what's been said already, but I have to say it. But also, actually, Africa's response in terms of contributing to the innovation. And let me just really expand on this a little bit. I think we saw not just the rapid development of diagnostics and therapeutics globally and the cooperation that we saw, but also it's the role of African scientists in Africa developing mechanisms to not only identify variants of the virus, but also prioritizing mutations, trying to understand very rapidly and efficiently the impact of these new variants. For example, the variant that was identified by scientists in South Africa, which was really important in understanding the transmissibility of the disease in real time, basically marshalling resources at their disposal, not only to understand the impact of this variant, but also looking at the effectiveness of the vaccines. So I think it's really important for us to remember this really worked was Africa's role in the innovation. What didn't work, I think it's been echoed. And of course, we're all singing from the same hymn, clearly vaccine inequity. But if I may add, it's also, we saw very stretched health system capacity, that essential health system facilities or services took a back seat. And I think that was, a downside of the pandemic. Thank you.
Thank you very much indeed. Professor Veronica, from your point of view, and feel free to narrow it down to Germany as well, what were the failures and successes?
Well, maybe from a funder's perspective or research funder's perspective, I can only support what has been said. I think the pandemic has impressively proven that investment in research and development is absolutely worthwhile and is going to pay off in many more ways than we ever imagined. And I think that investing in basic research and broad basic research, where sometimes you wonder, why would we ever need that? I think the pandemic answered that question, but also supporting the development of discoveries into products, into applications. That's certainly something that in this pandemic, that's like a use case of this. And so I think it's a huge success for the strategies in many countries and also in Germany to continuously invest in all kinds of research endeavors. And I think in terms of where's room for improvement, maybe, then there is, of course, yes, the inequity, but maybe another topic to think of is communications. We've seen how powerful good communication can be, and we've seen how powerful communication can be to dissuade people from, for example, getting vaccinated or from adhering to any type of public health measure, and to have a good look at that and to think about how can we have the communications part of our efforts better sorted out is certainly something to work for.
Yeah, that's really interesting, and I'm sure we'll talk about that at greater length. Thomas Cooney, from your perspective and from your industry's perspective, what went right and what didn't?
Thank you. I don't just want to echo what others have already said, the triumph of science and the way we developed at record speed and also scaled up at record speed vaccines. I think it was quite remarkable. When I look at actually other elements which were crucial and often neglected, is scientists had literally on day one access to the pathogens and the genetic sequence data, which did allow companies such as BioNTech, Moderna, and others to start developing the vaccines. They had unhindered access thanks to a German-based association called GISAID, which I think has been crucially important for the rapid response to that. Therefore, unhindered immediate access to pathogens has been important, will be important for future pandemics. Second one, and has also been mentioned, I was delighted to see a return to multilateralism and partnership. I do sit on COVAX, I do sit on the ACT-A, and what organizations such as Gavi and CEPI and others are doing is quite amazing. And I have to admit, I really congratulate Dr. Ngozi for the way she brought in WTO to call out trade barriers, which was one of those things which have hindered the scaling up of vaccines in many respects. And she brought in WTO there. Therefore, we have a few elements which really went well. There are elements which didn't go well. Let's face it, and José Manuel Barroso called it out, rich country healthcare systems were at least as ill prepared to respond to this pandemic as poor countries' healthcare systems. And I think there we need to learn, be cautious before you just cut down on infrastructure and healthcare costs. You will regret it. The second element, which in my view, we also, I think, all violently agreed, we need to make sure that in the future pandemic, we are better in terms of equitable rollout, sharing, overcoming vaccine nationalism, and talk about ways and means of really serving society wherever they are better, looking not just at the equitable, the poor versus the rich, but also about where's the public health impact the biggest, where's the need biggest, and what can we do in a future pandemic to do. There, so far, we again dismally failed.
Thomas, thank you. And Andrew, your thoughts?
Yes, and thanks, everyone. Good to be here. Well, the first thing I'd say is we've got to be a bit cautious to talk in the past tense. You know, this pandemic is still very much with us. So to talk about successes and failures, I'm afraid to say, is premature. And we've seen in different phases, right from the start, some countries that seem to be doing well suddenly lagging behind, others that were doing pretty badly improving. So I think it's a bit early for the final stock take. But if I'm to compare now with, for example, the bird flu pandemic, for example, a decade or more ago, there's no doubt this extraordinary acceleration of science, as we've heard. You know, everyone was saying even a year and a half ago, it's going to be 18 months minimum before we have a vaccine. And look where we are, much more advanced on that front. So that's been very promising. So has been data sharing, incidentally, in terms of, for example, the capacity to do trials, to do surveillance, to share genetic sequencing, to publish very rapidly for the benefit of public health officials what's going on where. And the intersection with that, of course, has been technology more widely, because heaven knows we'd have been in a much worse state if we didn't have access to this form of online as well as in-person meeting to allow economic activity to continue to operate, as well as indeed medical and other facilities. What's gone wrong, or what's, let's say, to paraphrase a politician, you know, kind of, we wanted things to be better, they've turned out as always, is an awful lot of the same sorts of things about inequity, about slow rollout, about uncertainties. Of course, we can talk about the treatment and support of the elderly that was long neglected and is a big driver of excess mortality over the last few months. Of course, the issue of equity in vaccines and access to affordable new medicines around the world. And alongside, I'm sure we'll come back to this, but alongside the, as it were, the supply blockages, if I can put it, though I think there are some quite worrying demand side challenges around rolling out an uptake of vaccines and medicines and other forms of intervention, which are partly scientific, they're partly about equity and politics and resources. They're also about human behavior and attitudes.
Thank you very much. And you're absolutely right that we are still in the throes of the pandemic. And I think, you know, in my own country, United Kingdom, we're still averaging 40,000, 45,000 cases a day. So no room for complacency. So let's dive deeper into some of those issues that we're talking about. And trade and trade barriers was one of the things that is clearly being debated. A lot of trade cooperation, policy coordination, all of which has been vital during the pandemic. Dr. Ngozi, if I can come to you, what is the picture regarding trade barriers, and what has it meant for access to vaccines and treatments?
Well, thank you very much. And many thanks to Thomas for picking up on this aspect of what we're trying to do at the WTO. So one of the interesting things about the production of the vaccines, of course, we found that we didn't have enough capacity worldwide. I'm sure Jose will agree. You know, we at Gavi and so on, in the past, we found that the world has a capacity maybe to produce 5 billion doses of vaccines. And all of a sudden, with this pandemic, we needed 2 to 3 times more than that. And these vaccines have very complicated supply chains, you know, that cross, in some cases, 19 countries, like in the case of Pfizer, maybe 12 to 15 countries for others. And so that means that any blockage on the way, or restriction, or customs regulatory procedures on the way of these vaccines flowing becomes a problem with respect to scaling up the production. Capacity, another problem. So here is what we try to do at the WTO. Its WTO members can impose export restrictions and prohibitions for short amounts of time. And at the beginning of the pandemic, there were about 116 export restrictions and prohibitions. And what has happened is focusing on these issues, monitoring what is going, being transparent about them, jawboning in the back to get these removed. We've come down from 116 to about 50. And this has been very helpful. In addition, I have to say that WTO members took many trade facilitating measures, trying to either digitize customs procedures or speed them up, bring down some regulatory barriers that were in the way. So this has been important. And I have to say that with the help of Thomas and his colleagues at the IFPMA, we've been able to meet or contact vaccine manufacturers to understand their problems intimately, even at very granular levels. And we've been able, I'm very proud of what the staff of the WTO is doing with them in trying to look at these issues and see what we can do to remove them. So that's where we come in. And at the WTO, we are working very hard. Our members are working hard to see what can be done to make sure that now, since the pandemic is still on, and in future, we minimize the export restrictions that may lie in the way of supply chains. And also for the future, what agreements do we come to make sure that if this happens again, this does not become a problem. Finally, let me just say that we've been working with manufacturers to also encourage them to invest in emerging markets and developing countries to deal with this issue of the concentration of production and exports, which I spoke about before. And I think some of this is paying off with new investments in Africa, Latin America, and elsewhere. Thank you.
Thank you, Dr. Ngozi, and I will come back to you to talk about that in a little more detail. One thing I wanted to pick up on, which a couple of my panelists on stage mentioned, was about this issue of pathogens sharing, which of course is vital in terms of developing treatments and vaccinations. And there has been issues with pathogen sharing. Dr. Veronica, let me ask you, just explain, the importance of pathogen sharing and how is it relevant during a pandemic? And I understand obviously the concerns about protecting biodiversity, but how do we balance that?
Yeah, that's an excellent question. I think the pandemic is again shows or demonstrates very, very vividly how important it is to have access to the sequences, but also to the pathogens themselves, to develop the countermeasures that we all need and want and ultimately benefit from. At the same time, the idea, the concept behind this Nagoya Protocol is that we want to have rules that support and incentivize an equitable access and benefit sharing so that we have the means to maintain and foster the biodiversity that we have and that we draw from for future pandemics or future crises and emergencies that may come. And the important part is that the sequence information stays outside of this, because we need those sequences to develop the diagnostic tools, the vaccines. I mean, that's exactly that. Within very few days after the virus appeared, the sequences were available, and that was the basis to have those vaccines ultimately that we have now. That was the basis to have the diagnostic assays that everybody benefited of. So we have to find smart ways to absolutely support the biodiversity and make sure that there's resources to do so, but at the same time, to make sure that research is not impeded by that, and access to the information we need to do research has to be part of these agreements.
Yeah, it's really interesting because I think it would not occur to most people that biodiversity would have an impact on something like developing vaccines. And Thomas, I know that this is something you're very concerned about, the Nagoya Protocol. Explain how slowing down pathogen sharing is undermining your industry's ability to deal with this pandemic and to prepare for the next pandemic. What are your concerns?
I'm really concerned about the future, because right now we benefited from something which was built up as a voluntary coalition of scientists around the world doing influenza surveillance. That's how GSAID came into existence, and literally everyone who worked on COVID-19, on SARS-CoV-2, benefited from access to GSAID data. Now, when you look at Nagoya and where could Nagoya come in, to some extent it is, and I will not mince my words, it is an aberration. I'm fully supportive of CBD. I'm fully supportive of the Nagoya ABS provisions because we want to plan to protect the biodiversity of plants, animals, and the human heritage. But pathogens, I don't know a society for the protection of the biodiversity of pathogens. We want to eradicate pathogens, therefore including, and it was something negotiated by ministries of the environment, unfortunately not many health people in there or no, because otherwise I can't imagine that they would have done that, because you have to imagine, China gifts us with SARS-CoV-2, a bad, pathogen coming out of China. It costs the world economy $375 billion a month. And fortunately, we do have the scientists, we do have companies investing in developing vaccines to get us out of this. And then we should sign a check, give royalties to the country who gave us that, whether it's China, India, Brazil, UK, or others, because some of those variants came from other countries. For me, this is the ultimate insanity which we really need to prevent for the future pandemic. Now, what's the impact? I can tell you, I recently looked into the case of influenza. We already know in influenza, we had a case where a country, virus was seen as most relevant for this current influenza season. And somehow the country was extremely slow in responding to the request for signing a material transfer agreement. Somehow there are rumors that somebody from WHO told them you should insist on ABS provisions. Simple fact is that the company had to go to a virus which was less yielding lower yields. Instead of producing 1 billion influenza vaccines, they produced 600 million. Imagine this happening in a pandemic like COVID-19, where you lose months, where we now had access within 24 days. And imagine, the chaos you would have when you need to bilaterally start negotiating. Now for politically correctness, the variants are called alpha, beta, gamma, delta, and no longer they came out of South Africa or from Brazil or from the UK or India or SARS-CoV-2 from China, but actually it doesn't prevent some of the countries sending letters to companies and remind them, look, we may ask for royalty if you come up with a vaccine. Honestly, I'm deeply concerned, and we need to make sure that what worked now well, immediate, unhindered access to the pathogens, works well in the future and is not compromised, because there are many countries actually who think this should become part of a pandemic treaty. And I think we better think twice before we create obstacles which we didn't have now.
Can I just ask a supplementary question, Chat? You mentioned that China had freely provided the genome for the SARS-CoV-2 virus. Can we not assume that other countries are going to do the same in the event of a global crisis like the COVID pandemic?
I can tell you there's a strong appetite when I look at the working group discussions on the pandemic treaty to insist on access benefit sharing, emphasis there on if you do get, you need to accept strings, you need to accept that you may have to pay royalties. And this goes even for pathogens when I've heard, concerns from a CEPI, which was confronted with this kind of Nagoya ABS discussion. Therefore, do not underestimate. I've been surprised talking to leaders of agencies. When I mentioned Nagoya, they looked at me and it was, what are you talking about? They didn't have a clue about the implications of that, because ABS, in Nagoya is really plant, animals, protect. It is relevant if, for example, you have from a plant, you derive a pharmaceutical which will heal people. And there I fully subscribe to the ABS provisions. Pandemic preparedness, pathogens, it's a different ballgame.
Okay, well, look, let's go. The issue of equitable access to vaccines is obviously one of the main issues in terms of a response to the pandemic. There's been a massively polarized discussion about trade barriers, on the role of the IP system with regards to access. We know there's been a proposal for a TRIPS waiver, but countries really very divided on whether that would help. Let me come back to you, Dr. Ngozi, on this issue of a TRIPS waiver. You've suggested there might be a third way. What is the third way? How does that help?
Well, thank you very much. Before I speak of the third way, let me just say a word on the TRIPS waiver, because it's at the WTO that this discussion is taking place and the polarization. And I think one needs to insist that we must come to some pragmatic solution on the TRIPS waiver. Developing countries, more than 100 of them asked for this waiver. So this isn't going to go away. At the same time, we have some countries who feel, they share the objectives of saving lives, but they feel the waiver is not the answer. In between those two positions, there are pragmatic solutions that we can come to. And whilst the formal negotiations at the WTO are not moving, we have informal discussions going on that I hope will come to a pragmatic solution. We really need that. Now, what I had said, I think well before even coming to the WTO, when I saw that these discussions could be taking long and being stuck and lives would be lost, I thought that there would be an alternative way of going about this. And that's what I called the third way, which is to really encourage manufacturers of vaccines to think in terms of partnering with appropriate manufacturers in developing countries and emerging markets, to actively look for sites there where they could work and transfer technology voluntarily, such as was done between AstraZeneca and SII in India during the time that I was chair of Gavi. We had this happened and it's worked. So I thought perhaps the first way is massively increasing production in current sites in developed countries. Second way is getting through with a pragmatic solution on IP. But a third way, whilst all this is going on, is really to encourage finding partners in developing countries, ramping up, trying to manufacture in those countries and transferring technology voluntarily to do this.
Okay, well, let me bring in Professor Kelly. What are your thoughts on this? Because obviously countries in Africa have greatly suffered in terms of getting hold of vaccines, Kelly. And one of the issues, as Dr. Ngozi was saying there, is about perhaps encouraging tech transfer in Africa. Is that practical? What do you think that can be done in the short term?
Thank you. Just before I even get to talk about tech transfer, let me just talk about IP very, very briefly.
Sure.
So first of all, I think let's be very, very clear. IP is very important. We must respect IP. IP is an enabler. There is so much commitment and financing that goes into research and development. There is no such thing as a free lunch. Somebody has to pay for it somehow. The IP system really helps us create an innovation ecosystem that provides incentives for the innovators to carry on innovating. I think that needs to be really, really understood upfront. Secondly, we need to balance the IP issues with the realities on the ground. At the beginning of some of the remarks that Dr. Ngozi made, she was talking about just limited capacity to manufacture vaccines globally. Now, if you take that and bring it, let's say, to my continent of Africa, the reality is that we need to take stock, recognizing that the COVID vaccines, a number of them are based on new technologies. They require specialized production capacity, ingredients, et cetera, and small equipment. That is the reality that we have to contend with. So whether manufacturers, as Dr. Ngozi was saying, voluntarily, willingly share the expertise, or IP is waived, there's a reality that we have to deal with, which is exactly that the current capacities need to be repurposed and scaled up. Now, when it comes to tech transfer, again, this is a novel coronavirus. It's not just new, it's novel. And the technology that we have today, vaccines in general, even without thinking about a new type of vaccine, they're very complex. You cannot just very easily reverse engineer them. So in other words, there has to be a meaningful process and dialogue
But isn't
either
this where partnerships come into play? Isn't this where other multi-sectoral collaboration comes into play, into helping countries achieve that ability?
absolutely, absolutely. So in other words, it's actually approaching this with humility and understanding that it's going to be tech partnerships. Now, why are these partnerships important? For the people with the technologies and the know-how. I mean, Andrew Jack was talking about, we're still in a pandemic. Today, one country is ahead of the other. Tomorrow, there could be a new variant that could just take us steps backwards. So it's in the interest of the people with the technologies to share it, but equally for the people that are going to receive that technology to take stock of the reality. Absolutely, there has to be a mechanism. And I think the encouraging reports that we've heard recently with the WHO partnering with a South African consortium, the BioVac Institute and Afrigem, and some of the COVAX partners, to really look into setting up a technology transfer hub for messenger RNA. These kind of initiatives need to be encouraged and supported. But there's no question that we've got to respect the IP, but also the reality that tech transfer is not going to happen overnight, but we are in a pandemic. And that's why there's got to be willingness for everybody to really share what needs to be shared so that the world, not individual countries, but the world can recover together.
Well, let me bring in Professor Jose on this because the ability to share vaccines, of course, is one of the things that COVAX has done. But there are still bottlenecks in place. There have been criticisms of nationalism, vaccine hoarding. How do we deal with this issue of making sure that all countries have equitable access to vaccines?
Yes. So the first fact, the fact that we have now COVAX with 193 governments, with almost 90% of global population, is in itself a success of multilateral approach. So is in itself a good example of collaboration. And it's not just governments. It's the governments and the private sector. IFPMA, by the way, I'd like to thank them. The pharmaceutical industry is there. Civil society is there. Research institutes are there, foundations. So it's a great example of cooperation. And there were some successes, like the fact that only 39 days after the first vaccines were deployed in the most developed countries, we had been able to give them also to some African countries. But, and that's very important, there was afterwards a problem of supply, partly created by vaccine export restrictions. By the way, I welcome the news of the government of India saying that it will soon resume exports. Until now, this was not possible because of the terrible pandemic that has hit that country. But it's very important because, as you know, India is one of the biggest producers of vaccines in the world, that those exports are resumed. There was also the hoarding, the accumulation of vaccines by rich countries. This has now been compensated partly by donations. More than 600 million donations have been pledged so far. Only 100 have been effectively delivered. So we need also to work on that. And we also need some more transparency in the system in terms of the supply, so that everyone can prepare on time, namely governments that also are facing extremely difficult logistical problems. So while there were and there are still cases of successful cooperation, the reality is that we still are, as was rightly said, in the pandemic. And in fact, we could have distributed many more doses. Until now, as COVAX, we have been able to distribute around 390 million doses in 144 economies. It means we can reach everywhere in the world, but we need to overcome those problems of supply that are still existing. And also, because this is, first of all, morally wrong, it's morally wrong that low-income countries are, depending on the way you count, at 3%, and the developed countries are at 70% of distribution. So I think now all countries need to make a real effort, and to keep this as a priority. That's why, for instance, last week I was in Brussels with Ursula von der Leyen, President of the European Commission, and she's committed to do more, and we are really grateful to the European Union. I also met Mario Draghi, my good friend, who is the Prime Minister of Italy, now is holding the chairmanship of the G20 presidency that are having their summit at the end of this month. It's critically important that the world understands that we are far from the end of the pandemic and that we have to continue this fight and also to prepare for the next one.
Jose, can I ask you, I mean, there are the richer countries on even now starting their third booster jabs for their populations, while there are people in African countries who've yet to receive their first jabs. What should we be encouraging richer countries to do in terms of many, many more vaccine donations, which they have, which they could give to poorer countries, but and have said that they will, but in practice, that seems to be slow in coming?
Yes, you are right. As a former prime minister, I understand that the first priority of any government is to support, first of all, its own people. And I understand that point. At the same time, we have to understand that the more doses we distribute in the rich countries without doing it with the other countries, it will delay the global response to vaccination. And I believe this is also short-sighted, because the more time the virus keeps on running all over the world, the more is the probability of new infections and also more transmissible and even more dangerous, more deadly variants. So this is why we need to combine the effort that has been done at national level with real generosity, enlightened generosity globally, through donations to also increased support financial to those who need, and also to trying to solve some of the problems of supply I already mentioned, like export restrictions.
Okay, so far we've talked a lot about trade barriers, we've talked a lot about vaccine equity, but of course there are other things that need to be in place to be able to respond to a pandemic effectively. Andrew, it's interesting that you've written a lot about countries which on paper looked like they were prepared for a pandemic, looked like they had a plan in place, but really weren't when reality struck. What do you think, having looked at the examples of what governments have been doing, what do we need in place for an effective pandemic response? Global health institutions, governments.
I think the first thing to say is that each pandemic is different. And of course, we know that one reason there wasn't more up-to-date preparation and response this time round was, of course, the time delay, and inevitably with political cycles and funding, priorities go elsewhere, and initial attempts to say we have to always be up-to-date and prepare for the next one fade away. But of course, the other thing is often one looks at the previous pandemic and its characteristics as the model for the future one. And as we know, that locked various people with simulations and so on into thinking we'll have another flu, but this time a much more dangerous version. And in fact, of course, we didn't. We had a coronavirus. And so the whole nature of transmission and response was fundamentally different. So that's one part of it. I think otherwise, though, one lesson that's come out from COVID is, of course, there are many different drivers and responses. And we talked about the elderly, for example, and that issue of care or neglect, frankly. But the social determinants of health that are often talked about, really fundamental. And if we look in a lot of countries, those who've been most severely affected by COVID have tended to be, for example, those who are obese, those who have diabetes, those who have other forms of underlying conditions, smokers, and so on. And so I think it's important also to pull back and not just focus on the narrow, current, and immediate, but actually look at these big universal drivers of health and ill health, universal health coverage as well. So funding, particularly shifting funding, I think, to much more to the prevention rather than to the late stage diagnosis and treatment is incredibly important. It's also very difficult, of course, to mobilize politicians and others because it's seen as abstract and a long way away and less tangible with less immediate benefit. But I think it's very clear from this pandemic that a lot of those who've been most differentially suffering higher rates of illness and death are those with those sorts of underlying conditions. And whatever the specific pandemic is that comes along in the future, I think those will be significant drivers on which we need to focus.
So improve the health of populations as a way of mitigating the effects of whatever pandemic comes along next.
Invest in health systems, try to ensure much more equitable access, try to really drive from late stage presentation to early stage prevention. And that means, for example, thinking a lot more about our lifestyles, about urbanization, about pollution, around the tragic effects of smoking and unhealthy diets, stimulating more improved exercise, a lot of those things really important. And then the facilitating infrastructure that we've talked about for rapid sharing of data, of insights, the ability to nimbly work towards clinical trials at scale to identify new and effective treatments and so on.
Right. Veronica, can I talk to you about leadership? You were talking about communication and political leadership. What is the German perspective on elements needed for a successful pandemic preparedness plan?
Yeah, so I think just following up on Andrew, so one thing is to look back at what just happened and to think how could we prepare better for a situation that is really surprising, rather than how can we prevent what just happened? Because one thing is certain, the next pandemic is not going to be the same as this one. And I know this is very easy to say, but how do you operationalize that? So the point will be to, on the one hand, really strengthen the structures that allow us to rapidly respond to a new situation, to a surprising situation. And that goes from all the prevention measures to thinking maybe about platform technologies, about diversification and resilience, just to have those buzzwords out there. But I think in the context of pandemic preparedness, they have a unique meaning, because it really is the situation. We don't know what is going to come and who is going to be affected in which way. So having, let's say, those production plants at different geographic sites is simply smart, because it allows us to respond maybe in regions that are not so heavily affected the next time around. Just to get away from poor countries, rich countries. I think thinking about it globally helps us also to identify the things and to prioritize the things to do. And I think having platforms and infrastructures that we can rapidly adapt to the question that arises will allow us to be better prepared for another emergency, no matter what origin it might have, rather than saying, oh, now this time around mRNA was the answer, so we have to have lots of that so that next time we are ready. Absolutely, yes, we have to have those facilities, but we also have to recognize that maybe next time there's another technology that is a game changer. Because if you had asked before the pandemic, well, how do we get that vaccine thing solved? Then we would have thought about, let's say, protein-based platforms or things like that. And they may still be the game changer next year as we go along. But at the moment, it was a technology that none of us had thought of as the breakthrough technology that ultimately gave us what we have right now. So I think being open and having systems that allow for those innovations to come through, that is going to be the key.
I think there's also a question of how much people trust what their governments are doing. We've got many different nationalities in the room today. Let's just have a show of hands. How many of you have been satisfied with the way your governments have responded to the current pandemic? Do you think that they did the right things at the right time? See, quite a minority. How many of you are confident that your government is busily preparing for the next pandemic and is putting the right mechanisms in place and has drawn on the lessons of this pandemic? Well, that's a resounding no. How important is trust in governments when it comes to leading countries and how they respond to a pandemic, with all the things that they have to put in place and what they're expecting people to do?
Yeah, without trust, we won't be able to do anything. But on the other hand, I think it is human to look at things and to think what could have been done better and to criticize what has been done. And that is the sign of all of us thinking about how to solve the problem best.
Yeah.
So I think that doing nothing isn't a solution. So if you do something, there will be people who feel that this wasn't the right thing to do, but that's exactly what we need, that type of discussion.
And that's exactly what we're discussing now, what lessons need to be taken forward. Professor Jose, if I can come back to you, we're talking about different countries and the robustness of their health systems in place when it comes to distributing vaccines. What do we need to do in terms of things like strengthening immunization programs and the resilience of healthcare systems?
Yes, first of all, in terms of routine immunization, it's something that the Gavi organization I have now the honor to share its board has been doing for more than 20 years, namely in Africa, in the most remote parts of the world, in some difficult to reach communities. And so we believe it's critically important to keep that effort of routine immunization. More generally, we have to invest in health resilience, as was already said. Every pandemic is different, so it's about health resilience. And if not now, when? That's the point. If not now, when are we going to do it? I believe now there is the argument to make, and that's an argument that I hope, for instance, G20 leaders will hear, that we have, I mean, ideally, if I want to be a little bit provocative, now we speak a lot about ESG, environment, sustainability, governance. I will add an H, ESGH, or if you want, H is part of sustainability. And this is both for the public and the private sector. We have to make this a priority because we have seen that the pandemic, besides all the human suffering, destroys the economies. Also, it creates very important geopolitical risks. Just think about the possible weaponization of infectious diseases. So it's a major risk from all points of view, humanitarian, in strict health terms, economically, socially, geopolitical. So that's why health resilience, to have proper systems that work on a continuous basis. And it's critically important. And we have seen that even at the highest level of the development in some of our countries, we did not have sometimes that capacity. But let me tell you, in middle-income countries also we have seen this. So they are not really ready. So this is why it's important that you use this opportunity to give health resilience the importance it deserves.
Thank you, Jose. Kelly, from your perspective, what do you need to see in place in African countries for better regional preparedness? What are the key enablers?
I'll say three things for me. Firstly, I think what the COVID pandemic has shown us is really the importance of research and development. Every single speaker in this session spoke about the difference that science has made to this. So Africa needs to really bolster its research and development capabilities to prepare adequately for the next pandemic, not just focus on identifying disease or mutants, but to go beyond that. Secondly, the issue of addressing infrastructural issues are really critical. Dr. Ngozi was talking about some of the trade barriers globally, within Africa as well. You know, I experience this with working with colleagues in many parts of Africa where it's actually a challenge even to be able to share reagents and chemicals rapidly, to move things across borders. I think we need to remove these barriers internally as well to facilitate really transfer and sharing of knowledge and resources. Thirdly, we need a vibrant, innovative R&D. Professor Jose Manuel Barros was talking about, if not now, when? We cannot afford just to be reactive. I think this is a moment to begin to seed an innovative pharmaceutical industry that will contribute health innovation solutions. And that's exactly why we at the University of Cape Town Drug Discovery Center, H3D, we have launched a recent partnership with the International Federation of Pharmaceutical Manufacturers and Associations, AFPMA, that Thomas represents, precisely to work towards reducing barriers to health innovation, to coordinate efforts across the continent and pull the resources together so we can develop a health innovation ecosystem, invest in critical infrastructure and develop talent, because I think that's the only way that we're gonna go beyond just identifying disease and strains and mutants. But of course, this finally really requires a network of partnerships model, recognizing that we don't have the benefit of time. And that's exactly why this partnership between the H3D Foundation and IFPMA is about really coordinating academia, the industry, and government to really have a common strategy to build the critical infrastructure, the critical technologies that will be needed that could be repurposed for future pandemics. Thank you.
Kelly, thank you very much. Well, let me bring in Thomas on that. So in terms of developing this innovation ecosystem and how, you know, the pharmaceutical industry can help bring down barriers and ensure equitable vaccine access. What are your thoughts on that, Thomas?
Now, I need to do a bit of a balancing act here, because on the one hand, I think we really were lucky to have a strong innovation eco-based system based on competitive research and a strong intellectual property system, which allowed us to respond fast. Having said, and that's one of the reasons why, you know, I'm really deeply concerned discussions about the TRIPS waiver are disruptive and wouldn't be helpful. And having said that, at the same time, I would be really challenged to say that as assertively as I do, if the industry would not have reacted in a business not as usual. Because what Dr. Ngozi said about the third way, to some extent, was one of the key elements of scaling up this vaccine capacity overnight. And she did say about the doubling or trebling of global vaccine capacity, but actually it was a doubling or trebling just for COVID-19 vaccines, and we still need all the other vaccines. This was only possible because of unprecedented partnerships, voluntary licensing, technology transfer. And we have seen this, an amazing collaboration, for example, between us, IFPMA, the big pharma association with our biotech colleagues, but also developing country vaccine manufacturers. We have seen more than 300 partnership contracts, almost more than 200 of them including technology transfer. And this is happening because companies trust a legal framework which gives them the assurance that when you sit down with your partner, they will respect the contracts, that you can help them to train skilled workers, to get the machinery, infrastructure, the supply chains, everything in place. Having said that, for the current pandemic, we need to do more to bring these vaccines, supply is no longer the problem, to the people who need them. But Dr. Ngozi has made one very important point, and José Manuel Barroso too. He, as Prime Minister of Portugal, was responsible primarily for the well-being of his own citizens, as President Biden is in the US or Chancellor Merkel in Germany. That will not change in a future pandemic. Therefore, we really need to look into where do you have the white spots in terms of capacity, technology, platforms. And the two regions, everybody talks about Africa, but Latin America is not much better served. Therefore, I think what we need to start now for future pandemic preparedness is how can we make sure that we do have these partnerships. I sit, by the way, on the roundtable initiated by the German government for vaccine manufacturing in Africa. It's an extremely constructive engagement, but this is not happening overnight in the next 3 to 6 months. This is an ambitious target for in 5 to 10, maybe even 20 years, but it is happening and it is needed, because whatever you now hear from political leaders, whether it's from France, Germany, UK, when it comes to a pandemic, political leaders have a primary responsibility to their own citizens, that I really welcome this kind of dialogue partnership which has been initiated, and I think we from the industry have a responsibility to be part of that.
Andrew, can I ask your thoughts on a lot of discussion about how we get vaccines more better distributed through low and middle income countries, African countries in particular, and this talk about tech transfer and African countries manufacturing their own vaccines. What are your thoughts on that? And is that feasible? I mean, it's clearly not feasible in the short term, but is that something that we could look to in the future?
So first of all, I think COVAX has played an important role, and it's a great instrument in principle. I think the challenge was it was always underpowered. It didn't have either the funding or the critical mass to really be able to kind of negotiate seriously and provide support that would allow investment and rollout to some of the countries in greatest need. I agree absolutely with what's been said, amongst other things, on IP. I mean, IP is a privilege which grants a monopoly in exchange for stimulating innovation for a finite period, but also comes with a transparency, of course, around the underlying processes, and with, if you like, a moral or political obligation to also be fair in pricing. I think maybe there's been a little bit too much focus on IP at the expense of know-how and some of the other blockages that we've seen in vaccines in the last few months. There's partly a stockpiling issue with sort of companies linked to individual regions or countries and certain legal obligations that were put in place that have made it difficult to then transfer surplus stocks elsewhere. I think tech transfer is absolutely fundamental, but I don't think we necessarily want to get to a stage where, as it were, each individual country is trying to create its own vaccine manufacturing or indeed drug development plants. Those are incredibly costly. One needs them to be at absolutely high quality regulatory standards, and it could actually be a much less efficient or cost-effective way to scale up and distribute vaccines. But clearly, if you only have a handful of countries producing them, you're going to get bottlenecks. And that's actually partly the consequence of a neglect over many years or a disinvestment because of vaccines weren't seen historically as a particularly lucrative area for companies or indeed countries traditionally to invest in and produce. So I think we need to rethink the whole economic equation, really, and I think that's a key starting point. And the other thing is, we've talked a lot about the supply side bottlenecks, but as I said at the start, I think also the demand side is concerning. And actually there are indications that there isn't huge demand or uptake and distribution capacity in many lower and middle income countries currently, whether for COVID or indeed for some other vaccines. And so we need to really think there also about investing in systems for effective distribution and working with vaccine hesitancy to improve the demand side as well as the supply side.
Andrew, thank you. I'm going to ask one last question to Dr. Ngozi, and then I'm going to throw the floor open for questions. We are getting a couple through on our online site. So again, if you're joining us virtually, please do submit your questions now. So last question to you in this section, Dr. Ngozi. You were talking about how we need to come up with pragmatic solutions for enabling vaccines to reach other countries and reducing trade barriers. You said, I mean, we know there are talks going on with the WTO, but time is of the essence, isn't it? So when can we expect to see some of these pragmatic solutions?
Well, thank you very much. If you permit me, just before I answer that question, I just want to add a couple of thoughts on the preparedness side to complement what colleagues have said. I think, I was part of a high-level panel set up by the G20 to look at pandemic preparedness. And there are two things I want to mention that haven't come up. One is that, we really need to have, there's at present no networked global system of surveillance that really works. And we need to be able to set that up. If we want to be really serious about the next pandemic, we need to have that. And the second, two other things quickly is global governance was really not adequate during this pandemic. Very fragmented approaches to the problem. We need to set up a global governance system, and funding didn't come on time. That was mentioned. Now the panel is recommending $10 billion per year fund to be put in place to help us pay for some of these things that need to be done. And it will really be remiss of the global community if some of these suggestions are not taken up, to enable us to be ready. What are we going to say when the next pandemic comes? If we fail to spend $10 billion a year to prevent it, and we spend another 20 trillion, to take care of it. So this is something that the international community and our leaders really have to take into account. Now, coming to the issue you raised about when can we expect? The WTO is a forum where members negotiate with each other to try to come to an agreement. So trying to predict the exact time when they will do this, I think it will be foolhardy of me to say. However, I can tell you what we are pushing for. We have this ministerial conference at the end of November, that starts on November 30th. And we're trying to see, can we come up with a framework for dealing with this pandemic and the next that will also involve this pragmatic solution on IP. And we're really pushing hard, saying, look, this is the time to do it. If we miss this opportunity, then the world will be looking at us and say, how is it that we couldn't accomplish this agreement? So we are pushing hard. I can't promise you that the solution will be there because it's the members who have to come up with this answer. But from my perspective as Director General, I'm certainly with the staff pushing and supporting as hard as we can to have a pragmatic outcome to the IP issue. I believe it's vital to save lives that we agree on this as quickly as possible. Thank you.
Thank you, Dr. Ngozi. Okay, I'm going to take questions now from the audience. I'm going to start with one that we've received online. This is from the Transparency International Global Health Programme. Thank you very much for the question. I'm going to paraphrase it. It's quite long. So the question is this: there are trends of low and middle income countries moving away from vaccinating priority groups. The moving away is due to reasons such as vaccine hesitancy or some countries receiving vaccines with short expiry dates. What have we learned from the response so far which will help to ensure equitable and transparent access to vaccines within countries going forward? I don't know, Veronica, do you want to say something about that? And vaccine hesitancy has been a huge problem, hasn't it?
Yeah, and I think this question really brings it to the point that this isn't a developed or industrialized world problem. It's a global problem, and this hesitancy has all kinds of roots, and it's not new. I think I read recently that vaccine hesitancy has existed since the first vaccines existed. So it is up to us to try to provide answers and to deal with misconceptions. And yes, I think that before you throw away a vaccine, you better give it to someone who's maybe not on the priority list, because everyone who is vaccinated is essentially in that game, us against the virus. It's one figure taken off the playing board, right?
Yeah.
So, but at the same time, we need to understand why somebody is hesitant to get this vaccine, and then try to help to address the issues that are raised. And if there was an easy answer, we wouldn't be talking about it. And I think the important part is really to listen to the recipients, to try to answer the questions. A big important thing was to go through the regulatory processes to make sure that we have tested the vaccines, that they are safe, that they are efficacious, and to reaffirm this and to answer the questions that are, or the concerns that are related to that.
Thomas, do you want to jump in?
If I may, I think basically it is a question about communication, as Veronica already said. It's a question about trust, and it's a question about leadership. I have to admit, as a Swiss, I'm deeply embarrassed about the amount of anti-vaxxers we have in Switzerland, and it is related to ineffective communication, lack of leadership, and lack of trust. And I think one of the elements, when I look at, I'm jealous of José Manuel in Portugal. Portugal is the leader in Europe and the world in vaccination, and would be curious to learn from him, what did you do so much better than, for example, the Swiss did? From an industry perspective, I think it has to be not cutting corners on regulatory, not allowing political interference and regulatory approval, and being fully transparent on the safety and effectiveness of vaccines.
Andrew?
Yeah, and I'm glad we're talking here not just about anti-vax as a movement, and of course that's an invidious situation, and we have to try to counteract that with reassurance and engagement and information, but vaccine hesitancy more widely, which is quite a complex phenomenon. And I think sometimes, including in my own country, there was a reflex to say this is the result of conspiracy theories. In reality, it's a humbling reminder that you really have to invest in outreach and engagement with many different communities. And there are many reasons why people might not be getting vaccines that aren't because they believe they're going to do them bad or they're not going to do them good. You know, very practical things. I mean, the UK set up these enormous vaccine centres, but in places where many people who didn't have access to public transport, for example, couldn't get to physically, where they were expected to queue in long lines, potentially at great risk as well as inconvenience, where there wasn't enough outreach to different cultural groups and ethnic groups in their own languages, with their own communities, through mosques and other sorts of institutions, or handling vaccination in the traditional way that doesn't perhaps respect the way in which vaccination has been done in people's own cultures and backgrounds. So I think that requires, you know, huge sensitivity and a really sort of multivariate approach, if you like, to understanding very complex and different reasons for it. It needs investment and reflection.
Thank you. Any questions from the audience? Hand up at the corner there. I think someone will bring a microphone to you. Thank you very much. And if you know who you're addressing the question to, please address it to that person.
Yes, thank you so much. I'm Elizabeth Masuda from Doctors Without Borders. I have a question for you, Mrs. von Messling. You mentioned that Germany will also in future be a great funder of R&D. So the question will be, will there be effective strings attached to this R&D for maybe pandemic preparedness, or in the sense of pandemic preparedness, for technology transfer, or for more transparency on the funding or the amount of funding that also went in from private and public side? Because there, as I know, there was a study from the, I don't know how to say it in English, the scientific service of the parliament that said that this would actually be possible for the next pandemic. So that would be my question.
So it's a really good point. I think that as we discuss more broadly about public funding, de-risking any type of development, in this case pharmaceutical development, we also have to talk about the pricing. And I think Tom has also addressed this. There is the discussion, I think the pandemic is triggering lots of discussions around this topic. And the important part, I think, will be that we need the innovation to happen. We need these things, we need the development. And I think there were many good arguments why patents and IP are an important driver for innovation. But at the same time, it is a justified expectation to say, well, if public funding is driving these and sustaining that type of research and development, then maybe we also have to be involved in discussing about the pricing, and that then leads to questions: what does actually which step cost, and how do we invest smartly, and what is an equitable return on that investment in terms of cost, but also in terms of access. And I think these discussions are ongoing, and Germany certainly has a very active part in these discussions. And I think having absolute things and great statements, that's very nice, but not very constructive. I think I really like this point about having like practical solutions to these problems, because that ultimately will lead to people having access, and that's what we all want.
Thank you, Veronica. Another question from the audience? I've got a bright light shining in my face, so please. Okay, gentleman at the back there. Thank you.
Is that on now?
That's on now, yes.
Good morning. Hi, my name is Austin Davis. I work for NORAD, which is the Norwegian Development Corporation. And my question was actually very much in the same line about public arguments about public investment in production of technology. What do we get back from it? But also, Andrew had mentioned about the difficulties of donation. So states are under a lot of pressure to donate surplus vaccines, but it's not as easy as that. Every country that procures has a different contract with every producer. And if we're going to structure the pharma market as a market, transparency of information is one of the requirements of well-functioning markets. And states need to know about supply to be able to be confident. So is it time to move towards much more transparent and standardized contracting, both in public support of development and public procurement, which can be then shared and have standard clauses in and can be more transparent and accountable so that markets can work better? Thank you.
Thank you. That might be a question for Professor Jose then. Why don't I come to you first then, Thomas? So what's your response to that?
Now, to some extent, that's one of the, the attractions of COVAX. I must say I was pleased to hear Andrew talking about the importance of COVAX, because having read the Financial Times this morning, I saw another article diminishing the relevance of COVAX, but COVAX has so far supplied 80% of what low-income countries got, and over the next few months, COVAX will receive each month as many doses as were shipped over the last 10 months together. Therefore, I think we will see a rapid scaling up of COVAX. But COVAX has brought something which is a framework agreement on some of the contracts of indemnification liability, no fault compensation. Because you have to realize developing vaccines at record speed was a no mean feat. But it comes with risks, and there will be side effects. We have seen some of the side effects. That's why making sure that if something happens, the patient gets an immediate no-fault compensation was crucial. And COVAX basically negotiated for all of the COVAX countries a framework agreement, which made it much easier to do that. Trying to standardize that all together, honestly, this will be incredibly complex and will be incredibly challenging, because individual companies with individual platforms have different needs. I would wish we would have fewer lawyers and more common sense in some of these negotiations. But for example, one of the issues on transparency of pricing, I'm deeply convinced that one of the reasons COVAX does pay has a best price clause, has a lowest price in it there, is because Gavi refuses to put their price transparently into the data bank, because they're absolutely convinced that if you would do that, the prices would rise. And you've seen this in many markets. Therefore, I think we need to have more common sense and some commonalities of framework, and COVAX really provided that. But at the same time, you also have to realize that different problems require different solutions. But I would be interested to hear Jose.
Yeah, let's get a comment from Jose. What are your thoughts on that, on transparency?
Yeah, I think the concept of COVAX is precisely by being cooperative, being able to buy large doses, being one of the biggest buyers of vaccines in the world. Of course, we have the possibility to negotiate good prices with the manufacturers. At the same time, we have also asked for increased transparency, namely in terms of the delivery, because to be very honest and to be very frank with all of you, sometimes we get the impression that some countries paying more, they can jump the line. And so I believe, and that's not good from a common public good perspective. Having said that, I also need to highlight excellent cooperation that we are having also always with Thomas and with IFPMA for addressing all these difficulties. So transparency, it's important. At the same time, it is important that we keep a flexible system like COVAX, that in fact, it's the only truly global system. The alternative is to do it bilaterally, not to do it with a truly global system. And since there was already a reference to my country, let me use this opportunity. I think it was Thomas who made it as well. Why it has been a success. More than 86% of the population of Portugal, above 12% already had two vaccines. It was a success, first of all, because there is a national health system. So there has been investment, But secondly, because there was a political convergence of the messages from all relevant, from the President of the Republic to the government, to different political parties. So there are also anti-vaxxers, but they have almost no representation. And thirdly, because logistically, the government has corrected the mistake. They had made at the beginning a political nomination, and afterwards they have chosen a vice admiral that is a vice admiral from submarine fleets. And you know, when you have submarines, you cannot improvise. It has to be everything very well organized. And this is extremely important to have an extremely effective organization from a logistical point of view, from an initiative point of view. And this is why, in fact, it has been remarkable, but coming from a very bad position some time ago. And as it was said before, we know that some countries, for instance, have been successful in the national health system, but they forgot about their care homes. And so there are hundreds of thousands of lives that were sacrificed, and the loss of life could have been avoided if there was a better preparation.
Thank you, Professor Jose. Dr. Ngozi, do you want to add to that?
Yes, thank you so much. I wanted to add something on the issue of transparency. I mean, I want to start by really saying a strong word of support for what COVAX has been doing, having been one of the people there when it was put together, and the barriers that stopped it from doing more. But apart from the 92 poor countries, you know, that are being served by COVAX, there's another side where there are middle-income countries, you know, who are also trying to get access to vaccines. And this is where the transparency issue comes in, because some of these countries have seen, at the end of the day, we've seen that sometimes they may end up paying higher prices for their own vaccines than rich countries, because there's no transparency about this pricing, this approach to pricing. Nobody knows what's happening. So I would say that whilst I agree a lot with what Thomas and others have said, we do need some transparency, because it's not right that if you're a poorer country, you should be paying more for vaccines than a richer country, because we don't know what is happening. And there's a task force of 4 multilateral organizations, the WHO, WTO, the IMF, and the World Bank, the 4 heads trying to work with the manufacturers to see how can we get a better line of sight on these, on the contracting, so that the poorer countries, poor countries, or let's say middle-income countries, who are small, who may not be that well resourced, don't end up paying more than the rich countries because of the way the whole situation is being handled. So I just want to say that transparency is important, and it builds trust, and we have to find some way to make it a little bit better than it is now.
Thank you very much. I think we have time for one more question from the floor. Any other questions? Lady at the far end there. Thank you very much. Thank you. Go ahead.
Thank you so much. Nina Jamal from 4PAWS International Animal Welfare Organization. When we look at COVID and what we learned from it, there's of course also the economic aspect, the economic pressure that this pandemic has had on our economies. What about the economic benefits of preventing a pandemic? Isn't that much cheaper than this entire pressure this pandemic has had?
That's an excellent question. Thank you very much. Let me pick on one of our online contributors. Professor Kelly, talk to us about the economics and how important it is when looking at the next pandemic, that we can mitigate those impacts.
Thank you very much. Of course, prevention is always better than cure, but this would require really across the entire globe, putting in mechanisms and systems for disease surveillance. I think that's ultimately, because when you look at COVID, right, that's why it was called the novel coronavirus. We've never seen this thing before, and things can happen very suddenly, especially when we neglect infectious disease research. And I think this is really, really important message here, that if there's anything that COVID has reminded us is the importance of infectious disease research and investing in infectious disease research, including antimicrobial resistance. So the things that took a backseat today, could be the pandemics of tomorrow, because we are always in a fight for survival with these organisms. So I would say to really safeguard our economies is we know that not everything is 100%, but we can do more with really empowering and equipping the various communities around the globe with tools to do surveillance and really have early warning systems, developing platforms that I think could be repurposed. I think Veronique was alluding to this earlier. So I think it's going to take this coordinated effort, this network of partnerships across the entire globe, when we recognize that we're all going to suffer economically if one country gets hit.
Thank you very much. And Andrew, you want to add to that?
Yeah, just briefly, and it goes back to Jose's point earlier about ESGH. We talked about prevention. Of course, it's better, and of course, it needs more surveillance. But let's not forget the intersection with climate change here, amongst other things, because why are we seeing this growth in pathogens and their spread around the world? It's very much linked to issues of deforestation, urbanization, pollution, mixing together of the natural and the human world in ways that we didn't see in the past. And so I think we do have to make that really important connection if we're truly interested in prevention and mitigation.
Great point. Look, we're coming to the end of our discussion now, and I just want to ask all of our panelists for a final thought, a final call to action from each of our speakers. I'm going to limit you to around 30 to 40 seconds each. And the question is this: what one thing would you say urgently needs to be changed to ensure an efficient response to both this and future pandemics? And let me start with our online contributors, Dr. Ngozi, if you can tell us what your call to action would be for a more effective response.
My call to action will be a better global governance. It's too fragmented, the approaches to this pandemic and the next one. We need a global governance system to make it work.
Thank you very much indeed. Professor Jose.
Following Dr. Ngozi, better global governance, certainly, for a higher priority for health resilience, having a comprehensive, holistic approach to health, because this vaccination, this issue of pandemics is part of a more global problem, including the resilience of our health systems. So yes, we need a global governance with a clearer priority for health resilience. And if I may, I think we need to combine that global governance with flexibility. That's why I believe, for instance, that Gavi or COVAX should be part of that global governance that should, of course, have at the center the WHO.
Thank you very much indeed. Professor Kelly.
Well, speaking as an African and on behalf of my continent, I think that the one really important takeaway message is for us now in Africa, I think, to reevaluate the learnings that we have from the Ebola crisis, which I think really provided a blueprint of how we can develop new financing mechanisms, et cetera, and also the lessons of the COVID pandemic, to see how going forward we can play a more proactive role so that we are better positioned to benefit from the global successes, which means really investing in developing health systems and research and development so we can go beyond just disease surveillance. Thank you.
Thank you very much. And same question to my panelists on stage. What would you say needs to urgently change or be done to ensure an efficient response? Professor Veronica.
Yeah, so I think that we have to really go about finding ways to deal with the systemic market failure in the development for those vaccines and drugs that we need for emerging infections. And we need to think about how our research and development landscape has to be set up so that the next time around we are able to respond quickly to those things that are thrown upon us by nature. And that means we have to make sure the research community works together, research and industry are working together, and we need to find smart ways to finance this so that it is actually affordable and fulfills our expectations.
Thank you, Thomas.
Now, surely for the future pandemic preparedness, we're coming out with industry perspectives on what to do for future pandemic preparedness. But what we need to do today and start today, in my view, we really need to sit together among those concerned to talk about how can we overcome bottlenecks, the constraints for the dose sharing, for getting the vaccines to those who need them, for addressing the legitimate request from countries to be informed in advance of how many doses are they getting, when, what are the bottlenecks, and that's where we need to sit down manufacturers with Gavi, with UNICEF, because they are rolling out and the intermediaries to the countries, and that we need to start today, because what Ngozi and Jose said, I fully agree with them.
Thank you. And Andrew, your final thought.
So the missing ingredient that we've seen in all these past attempts to try to predict unsuccessfully how countries would respond to pandemics is political leadership. And I think we need that both domestically, but also with a global perspective by political leaders. That's fundamental, whatever the nature of the pandemic or the tools and the other preparative approaches. The second thing, making the segue to our next session, where we're actually launching the Lancet FT Commission on governing health futures, this concept of data solidarity, because I think very often one hears that the limiting factor and the costs of clinical trials and drug development are the huge costs often of collecting patient data. And I think we really need to think about a new balance between the public good and the private benefit of data around clinical trials and more generally, as we've heard earlier, surveillance, pathogen sharing, and so on.
Thank you very much indeed. I think a very slim silver lining of the current pandemic is that it can help us prepare for future outbreaks if we harness what we're learning correctly. Thank you very much indeed to you, the audience, for your questions. Thank you to all my speakers today. It's been a really interesting discussion, and that brings this session to a close. Have a very good day.